Well, there's a routine way that we approach patients in the office, and this is true across most medical specialties, and it starts with a good history. Very That's the kind of where the gold nuggets are most of the time, is just listening to a patient, learning what they have to say about what the problem is, and directing them with questions that help them. Once we have done the history, we're starting to formulate a pretty good idea what might be wrong, but we also look at, and they've usually filled out forms or now on the computer, information that gives me just kind of a snapshot view of their medical history. So their past medical history, other problems they may have, and medications they're on, everything to allergies. Are they smokers? Do they drink alcohol? Caffeine can play into some disorders. And then we just kind of do a general review of other systems that maybe aren't in the head and neck that we'll look through as well. And then we get to the physical exam. And that part is something we would expect, and the patient can expect, to be limited to the head and neck. We'll look in their ears and nose and throats and feel their neck, and certainly focus that exam based on what the problem is. And sometimes that will involve what I would call minor procedures or office procedures, almost an extension of the physical exam. There are not a whole lot of things that we do in the office patient needs to be too uptight or concerned with coming in to see us. Some common things with the ears, we might sit them back in a chair and use a microscope if there's something that needs to be done in terms of cleaning an ear or looking closely at an eardrum. In the nose, sometimes we'll introduce what's called an endoscope. And same with, if we want to go through the throat, we can actually get through there with a little endoscope that goes in through the nose, and we reassure patients. We put sprays in the nose that help with the numbing process and help to kind of open the space in the nose up so it's easy for us to get through. And most people will say it wasn't as bad as they would expect when we do a procedure like that. And certainly we have patient comfort in mind. So that's usually again going to depend on what the issue is, why they're there to see us. Once we've done our physical exam, then we kind of go through an impression and plan phase where we say, listen, this is that list, this is what I think might be wrong, and based on that, this is what I would recommend for treatment. And the treatment could take the form of very conservative strategies, things that you can do without a prescription. It can take the form of medications, and certainly, depending on the problem, surgery. I'm the type of physician who, when presented with a surgical problem, I kind of grade it depending on the severity of the issue. The term elective would mean that it may be their choice. It may be something that I say, I could probably get you breathing better through your nose quickly this way, but if you'd rather, we can try these medications and nasal sprays. And so we go through all of that. If there is surgery or treatments like allergy shots, we go through the risks of the procedures and the benefits and the alternatives and the reasons why we're doing it. So we go through that each time in some form or fashion.